mastitis, which develops in a woman just after having a baby, whether or not she's breastfeeding. And in this case, the milk ducts are infected. The lump is usually felt behind the nipple. The breast itself can be very painful, can feel hot, and the skin of the breast, especially around the lump and the nipple, can look red, bruised, or darker. Some women may also have a nipple discharge, and you might find their nipple is pulled in or inverted in some cases. When somebody has mastitis, they usually will have a high temperature in addition to some of these other symptoms. But mastitis could also affect anybody else unrelated to pregnancy or breastfeeding. For example, people who smoke are more at risk of mastitis because the chemicals in the smoke could damage the ducts behind the nipple, making them prone to infection. Smoking can also delay the healing process. Something else that can lead to infection of the milk ducts is having a nipple piercing. So we've looked so far at some common causes of breast lumps that are benign, though they can cause a lot of distress in many women. I'd also like to mention something I heard from someone recently called a breast fibroid. Let me know in the comment section if you've heard that term before. It's a term I've heard a few people use, and it's a bit difficult to work out what they're talking about. First, in medical terminology, there is nothing like breast fibroids. Fibroids are benign growths of the womb. The causes of fibroids are not fully clear, but we know there's an element of hormone imbalance with estrogen and progesterone being mainly implicated. But there are other factors like your genetics, your age, your environment and environmental pollutants, your diet, and so on involved in the development of fibroids. So of course we know that hormone changes can be related to several conditions in the breasts, such as fibroadenoma, cysts or PASH, which I've just been describing. But this does not mean that you have fibroids in the breasts. You can have fibrocystic changes in the breast, which means having fibrous tissue and cysts develop under the influence of hormone changes, but it is not the same as fibroids. And fibrocystic changes are often normal changes which could lead to lumpiness in the breasts. So let's go on. The sixth type of lump we're looking at today is the ductal carcinoma. So here we're looking at other causes of breast lumps, and this is a type of breast cancer or malignancy. Cancer can develop around or in the milk ducts. There is a non-invasive type that starts in the ducts and does not spread beyond the walls of the duct. This is ductal carcinoma in situ or DCIS. It's also